Hi, everyone. Welcome to Policy in Action, How States Can Champion Child Nutrition Amid Federal Cuts to SNAP, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show CC in the bottom taskbar and select English as the spoken language. At the end of the presentation, we'll have time for questions and answers. To ask a question at any time, please use the Q&A tab, also in the bottom taskbar. With that, I'll pass it off to my colleague, Erin Heisem, Senior Child Nutrition Policy Analyst at FRAC. Take it away, Erin.
Thanks, Steve, and welcome everyone to FRAC's Thursday webinar. We're so excited you could join us today. Next slide, please. For those of you who may be new to FRAC, this might be a first webinar, might be unfamiliar with who we are. We are the Food Research and Action Center, leading national nonprofit working to end poverty-related hunger here in the United States. And we do that through a variety of ways, mainly training and technical assistance, conducting research, and advocacy at the local, state, and federal level. Next slide, please. We have a lot to talk about today. I am so excited to introduce you to our passionate panel of state anti-hunger advocates, Sydney Anderson from the Tennessee Justice Center, Lisa Pitts from Hunger Free New Jersey, and Julia Gross from Maryland Hunger Solutions. They are going to share so much information on legislation that they have passed in their state, what has worked, what has hit some roadblocks, what they're currently working on, and what their future holds for them and child nutrition access in their respective states. But to set the stage, I'm going to start off talking high level about the state of school meals and child nutrition programs in general. So let's jump right into it. We always start looking at the data and looking at participation data, the number of meals served, the number of children participating in school breakfast and lunch in a given school year. But data, as we know, it really just tells a bigger story. And part of the story that I want to tell today is about the impact of policy and how policy really drives participation and primarily drives children's access. Looking over just the last few years, you can see starting in 2022 that we had this peak in breakfast and lunch participation, and we haven't quite recovered and reached that number yet, even from last year. And we all know, or most of us should know on this call, that increase, that drive, that height in participation in the 2022 school year was driven primarily by federal policy, those waivers that USDA released during COVID that allowed all schools to offer all children healthy school meals at no charge, regardless of household income. Really doing a national test run on a healthy school meals for all or a universal free school meals policy, revealing what is possible when we reduce barriers, when we reduce administrative hurdles and operational complications, and we focus on giving children access to the nutrition that they need to succeed throughout the school day. Obviously, when those waivers ended in 2023, participation dropped. A lot of those barriers to both the child and the operator returned. But if we were to dig deeper into that data, what we would see is that decrease from 22 to 23, that wasn't uniform nationwide. States really led the charge in healthy school meals for all, beginning with California and Maine. And when states started to adopt these policies, they actually didn't experience that drop in participation that we saw nationwide overall. 2024, we had even more states adopt healthy school meals for all policies. And 2025, now this school year, we have 9 states nationwide with healthy school meals for all policies, really ensuring that children have access to school breakfast and to school lunch. We also have states leading the charge in universal free breakfast programs, and you'll hear from some of our panelists today about what school breakfast legislation looks in their state and how they are ensuring students start their school day nourished and ready to learn. We also had states at this time that adopted community eligibility provision policies, CEP policies, looking to subsidize schools' ability to implement the community eligibility provision and to offer free school meals to all students. And then states deciding whether or not they're going to adopt summer EBT, if there's going to be policies to strengthen after school meals, really leading the charge when the federal regulations or federal policy and legislation might not be moving as quickly or in some cases at all. Next slide, please. Oops. So this slide got a little messed up, but that's okay. There's a lot of influences into school meals. And when we often talk about school lunch, what most people think about is the lunch tray itself, the food that's being served, maybe where it's being purchased from. But I'm sure that many of you on this call realize that there's a lot of different factors. There's a lot of different influences that guide what schools can purchase, how they prepare it, and what ultimately winds up on a lunch tray and what students will eat. From budget concerns and high food and labor costs to labor challenges themselves of is there staff available? Do we have skilled labor to prepare the meals that we want to prepare? Is school meal debt affecting a school's ability to purchase food and to serve free school meals to everybody? There's been a lot of talk around ultra-processed foods, really, and the MAHA movement and the dietary guidelines for Americans, and how these nutritional policies that lead our nation are going to factor in to the nutrition regulations and the nutrition standards of school lunch. And then here at FRAC and with our partners on the panel today and with many of you across the nation and on the call, really looking at HR 1 and the impact that the SNAP and Medicaid cuts are going to have on child nutrition programs. So we'll talk about that in a few slides. Next slide, please. So it has been quite some time since we've had child nutrition reauthorization. In 2010, the administration passed the Healthy Hunger-Free Kids Act, which really was the last time we had robust and comprehensive legislation guiding our federal child nutrition policies. We have not had child nutrition reauthorization since that time. However, that's not to say that there aren't federal policies that are impacting child nutrition programs, from school breakfast and lunch to summer EBT and even after school meals. We know the Budget Reconciliation Law, HR 1, that was passed last July, didn't explicitly name school meals or summer EBT or WIC in the legislation, but the cuts to SNAP and the cuts to Medicaid, they're going to have a direct effect on children's ability to access these programs. We have spent a lot of time at FRAC talking about this in partnership with many of you. So I'm going to touch high level on some of that, but at the end of the webinar, I'm going to share some resources that if you want to dive a little bit deeper into the impact of HR 1, we'll guide you to. We'll include them in the follow-up email at the end that everyone who registers for the webinar will get, and we'll link you to all of our resources so you can get a deeper understanding on the impact of HR 1 on all child nutrition programs. Next slide, Steve. So as you know, children who receive SNAP and children who receive Medicaid and are within income limits for Medicaid are automatically eligible for free school meals. The cuts to SNAP in particular in HR 1, cuts to SNAP and Medicaid that will reduce children's enrollment in those programs are going to have a negative effect on school meal programs. It's going to sever or cut that direct link to free school meals, and it's going to hinder schools' ability to implement CEP. It's going to increase paperwork burdens on both the family and the school district, and ultimately eligible children will fall through the cracks. The cuts to SNAP are not only going to increase hunger in homes and communities, but because of this interconnectedness between SNAP and school meals, the cuts to SNAP are going to also increase hunger in the classroom. So let's just take a little deeper look into that on the next slide. There's a lot of provisions in HR 1 that gut the SNAP program. All of them are harmful and detrimental, and all of them are concerning for individuals and communities across the country. And as I mentioned, we have a plethora of resources that I will share that You can look at each of those cuts and the impact that they might have on school meals or summer EBT. But I want to highlight the administrative and benefit cost shifts that are going to increase costs to states in administering the SNAP program. So, as states face increased costs to administer SNAP, they may take efforts to reduce those costs, which means they may try to limit SNAP enrollment, SNAP rosters. And as children lose access to SNAP, we all know they lose their direct certification for free school meals, and it hinders the school's ability to implement CEP. There's a ripple effect throughout a multitude of child nutrition programs, however. Decreases in direct certification may also impact area eligibility for summer and after school meal sites. Decreases in direct certification is going to increase paperwork burdens in summer EBT. So those children who were automatically eligible for free school meals, they lose SNAP. Now they also lose their streamlined certification for summer EBT, and they are going to have to face that barrier, that hurdle of applying for the program with the state agency having to process that application in order for them to receive summer benefits, which are so vital to fighting hunger when school is not in session. The increase to state budgets to run the SNAP program is going to threaten states' ability to fund other nutrition programs like summer EBT, like healthy school meals for all. There's only so many dollars to go around, and now we're going to be fighting against each other just to make sure we have a well-nourished and thriving society. Next slide, please. OMB estimated that the administrative and benefit cost shifts alone, that single provision, it's estimated that nearly 100,000 children are going to lose nutrition subsidies just from that provision. But one thing that we're really watching is broad-based categorical eligibility. Broad-based categorical eligibility is an option in SNAP that states may use to streamline the administration of the SNAP program. It gets a little more detailed and nuanced, and again, I can refer anyone who's interested to my SNAP colleague and resources at FRAC, but essentially, we've seen this happen before. Trump administration, in their prior term, Trump 1.0, they proposed a rule to cut broad-based categorical eligibility nationwide. And that 2019 analysis found that cutting broad-based categorical eligibility nationwide would result in 1 million children losing their direct certification, their direct link to free school meals. Since that analysis was conducted, even more states have implemented broad-based categorical eligibility. So then it stands to reason that even more children are going to be affected. Even more children are going to lose their direct certification for free school meals. Next slide, please. But there's also been a lot of really positive momentum in child nutrition programs. And one of the biggest things we like to champion is healthy school meals for all. As I mentioned, those federal waivers during the COVID-19 pandemic really served as a test run for a national healthy school meals for all policy. And since that time, we have 9 states nationwide that have implemented their own policies, allowing schools to offer all children free school meals. You can see those states here in green. We also have 3 states in the District of Columbia that have free breakfast programs, healthy school breakfast for all. And you'll hear from some of our panelists that are working towards free universal breakfast in their state. And then the majority of the remaining states, all these states in that gold color on our map, they have formed coalitions or introduced legislation to get healthy school meals for all passed within their own state legislature. Because once a community experiences the benefits of free school meals, they don't want to give it up. These are educational benefits. These are health benefits. These are operational benefits to make running the programs easier. Healthy School Meals for All is an investment in our children today and in our future. And states and communities are recognizing this, and they are really taking up the role in ensuring children have access despite the lack of momentum potentially at the federal level. Next slide, please. Community eligibility is another strong program that is actually a local decision. So school districts can make the decision to implement the community eligibility provision or CEP and offer free school meals to all of their students. And since this first became available in the 2014-15 school year, we have seen a tremendous boom in adoption. With last school year, 1 out of every 2 schools that operate the National School Lunch Program use CEP to bring free school meals to all of their students. And while this is a school district decision, we have states across the country and states that have introduced legislation and states that have already passed legislation that help support schools' ability to implement this program, particularly at lower poverty levels. We know in community eligibility schools, federal reimbursement is based on the share of poverty or the identified student percentage within that school. And the higher the poverty within the school, the more federal reimbursement that CEP school receives. The lower the poverty within the school, the less federal reimbursement. And so sometimes at lower eligibility levels, even if a school is technically able to adopt CEP, they can't always financially make it work. And that's where local and state policies are stepping in to help support those schools so that every child has access to this program and every school that is eligible is able to participate. Next slide, please. But we wanted to spend the bulk of today's webinar meeting and discussing all about state legislation with our panelists. So I'm going to introduce Lisa Pitts from Hunger Free New Jersey to come on screen. And Lisa, tell us a little bit about Hunger Free New Jersey, who you work with, what you've done so far to date, and the legislation that you've passed.
Sure. Thanks so much, Erin, and thanks for having me here today. I'm Lisa Pitts. I'm with Hunger Free New Jersey. We're a statewide anti-hunger advocacy organization. Our mission is to improve access to healthy food for all in New Jersey. Our primary focus of our advocacy is really on expanding access to the federal nutrition programs, including all of the child nutrition programs. We advocate on the federal, state, and local levels, as well as provide education and outreach strategies, training and technical assistance on all things related to hunger and food insecurity in New Jersey. So what have we done over the past couple of years? We've actually made quite a bit of progress in New Jersey. It's been an exciting time over the last 7 or 8 years on the child nutrition front. We have been engaged in, we've had several pieces of legislation that have passed. We had a breakfast after the bell mandate legislation that passed in 2018, which required all schools with at least 70% kids eligible for free and reduced price school meals to operate a breakfast after the bell program. We eliminated the reduced price category for school meals the following year in 2019. It was implemented the year after that. And then again, in 2022 and 2024, we had a piece of legislation that was introduced and passed called the Working Class Families Anti-Hunger Act. And that expanded income eligibility for free school meals to more students in New Jersey. We now have any child in a household with a gross annual income at or below 224% of the federal poverty level now has access to free breakfast and lunch at school. So the state has really been committed in making incremental changes to improving access to free school meals for more kids in New Jersey. I would say another thing that we've worked on that has been really exciting and has really moved the needle on expanding access to free school meals for more kids is we advocated for the state agency to implement Medicaid Direct Cert. We did advocacy over many years on that, and then finally last school year the state implemented Medicaid Direct Cert. It was a huge game changer, as we expected it would be, and expanded access to free school meals for tens of thousands more students in New Jersey starting this school year. We had about 161 school food authorities opt into CEP this year as a result of Medicaid Direct Cert expansion. That's almost double from the previous year. We had about 82 school food authorities in CEP the previous year. So now between the legislative efforts to expand income eligibility for free school meals and the expansion of CEP through Medicaid Direct Cert, we have tens of thousands more kids in New Jersey with access to free school meals. Oh, how did we get here? Sorry, I forgot about that part, Erin. I mean, we're very fortunate in New Jersey. We have a big champion in our legislature and our speaker. We have many, many partners that we work with that we've worked with for years. A lot of education partners around the table, statewide education groups, including New Jersey PTA, School Nutrition Association, business administrators, supervisors, superintendents, and principals. And then, of course, we work with a very broad and wide network of advocates in community and faith-based organizations across the state.
Thanks, Lisa. It's so interesting to hear the stepwise piece. I think it's really important to reemphasize that no state goes from no school meals policies to universal free school meals policy. There's all of this work that happens beforehand and all these steps along the way. And that's something we try to reiterate time and again at FRAC is while we continue to advocate on a national level for healthy school meals for all, as states are passing these policies, really looking at some of these intermediary steps. And I think you've really demonstrated that beautifully. Cody gave you a shout out for the graphic. You know, I love this graphic, being a Jersey native and being very comfortable with my exit numbers and my turnpike and my parkway numbers. New Jersey is known for our major roads. So I think this was such a beautifully done graphic. But thank you for sharing that. I can't wait to hear what you're doing this session. But I'm going to turn it over next to Julia in Maryland to kind of hear a little bit about Maryland Hunger Solutions and the history on legislation that you guys have all passed and what has really worked to get you where you are today.
Great, thanks, Erin. And I agree, Lisa. I love that graphic. I might have to steal your idea and turn this into a little roadmap as well to include some other policies outside of CEP. This graphic does mostly focus on our journey from the beginning of CEP implementation to where we are as of a couple of years ago. But I did want to include some of our other legislative wins. Like a lot of other states, we have eliminated the reduced price copay as well. And we also have a very special universal breakfast after the bell program called Maryland Meals for Achievement. This is a program that's been around since the 90s and has gone through many iterations and many different funding levels, but is available to any school with over 40% free and reduced price meal rates. And they're able to opt in and provide breakfast after the bell to all of their students at no cost. And before I move on to this graphic, I realize I didn't even introduce myself or Maryland Hunger Solutions. So I'll back up a little bit. I am with Maryland Hunger Solutions. We are a statewide nonprofit that, again, works very similarly to New Jersey in a lot of ways. We help create sustainable connections between families and nutritious food through connections to federal nutrition programs and expanding access to those programs. We are a statewide nonprofit and a state initiative of FRAC. We provide SNAP outreach assistance as well. So we are a state SNAP outreach partner, but I focus on our child nutrition work. So covering all of the child nutrition programs with a very heavy focus on school meals, as healthy school meals for all is, again, one of our big priorities. We are hoping to get there eventually, and are currently working on various steps to kind of keep that journey going. But looking at this graph, thanks for pulling this for me, Erin. We did have a lot of steps along the way to get to where we are with CEP and the universal meal program that we do have in our current schools through CEP. A couple of our really big and impactful policy changes that we've implemented are actually a little less obvious, I think, than a lot of some of the bigger ones like universal breakfast programs or the reduced price copay. In 2015, as you can see, our first big jump there in this graph, that was one of our very first policies to help reduce some of the barriers to CEP implementation. And it actually had to do with state education funding. One of the big barriers that we saw at the very beginning of CEP was the challenges that happened when schools switched from collecting free and reduced price meal applications to using direct certification. And it can get a little wonky in terms of how that policy works. But in Maryland, our state education funding uses the free and reduced price meal rates. And a lot of our other education funding relies on those numbers as well. And so when schools switch to the direct certification, straight direct certification numbers with the implementation of CEP, there were a lot of challenges around how to make sure that schools didn't lose that education funding. We believe that schools and students shouldn't have to choose between a world-class education and access to meals. They go hand in hand and work together. So that's absolutely something we wanted to make sure that schools had access to, and that was a solution that could be solved. So this piece of legislation allows schools to kind of freeze their free and reduced price meal numbers from the year prior to implementing CEP. It's a hold harmless provision that has been in place since 2015 and has been working. It's not necessarily a long-term solution, and I know I'll touch on that a little bit more when we talk about what we're working on currently. But at the time, it did allow one of our biggest districts, Baltimore City, to go district-wide, and our CP numbers jumped and continued growing since then. So I know a lot of districts would not have been able to implement CEP at that early stage without that piece of legislation. And then our other big jump, you can see in 2022, 2023, again, it wasn't a piece of legislation. It was when our state decided to opt into the Medicaid Direct Cert pilot program. So that was also a huge game changer for Maryland. We identified, I think, over 110,000 additional students that year who were qualified for free and reduced price meals. Our identified student percentages jumped. And you can see the next school year, our number of CEP schools across the state also jumped and has continued to grow. We have over 700 schools operating CEP now across 19 districts. 9 of those districts are district-wide. So that's been a huge, huge game changer for us. Again, a lot of our partners are similar partners to, I think, a lot of other states who work in the anti-hunger space. Our biggest food banks are often champions along with us, our School Nutrition Association. We've had a lot of support from our public health sector and research partners, which has been really helpful. We also have our education partners. A lot of unions have been on board with our work. And then I also want to give a shout out to our state agencies as well. I know it's such a huge difference to have state agencies that are communicative and willing to partner and brainstorm and work with the advocates around them. So in particular, our education agency has been really helpful to a lot of these policies and helping champion them along with us.
Julia, thank you so much. There's so much there I was taking notes on. I want to go back for a second to talk about MMFA, Maryland Meals for Achievement. I don't know if I have this year right, so nobody quote me on this, but I think it was like 1996 is when it first started, and it started as a pilot, right?
Yeah, it was a pilot and it started in 1998 and then
Eight.
became a permanent program in 1999. So a pilot, I think it started this was way before my time at Maryland Hunger Solutions. So again, don't quote me, I might be wrong, but I believe it started in 4 schools in 98.
And I think that working with you now for a number of years, that is something, correct me if I'm wrong again, that you often say that Maryland loves a pilot, right? And you kind of start, you always just kind of test the legislation a little bit and introduce a pilot. And even with CEP, I think some of the strategy has been like, for school districts, because for anyone who might not know, Maryland has county-based school districts. And so they have some of the largest school districts in the country, which you might not always realize. I'm based in Montgomery County, Maryland, and there's over 200 schools and 160,000 students in the school district, and they speak nearly 200 different languages at home students. So there's some benefits to large school districts when you talk about economies of scale, and then there's also some challenges that are unique to districts of that size. So I love that when you always talk about, we're just going to pilot this, we're just going to test it. And then once people start to get a taste for the benefits of a program, then the legislature kind of follows suit. Is that an accurate description?
Oh, that's definitely accurate. Yeah, I would say Maryland is, our legislators are very supportive of feeding kids, so we're lucky in that respect. But I do think that sometimes the understanding of programs gets in the way a little bit. And so when you see that first year, if it works, in a small amount of schools, and it really helps them understand the impact, and kind of it goes from there, it expands from there.
Thank you. Yeah. And shout out for all our state agencies. If anyone's on the call, we know that vital role in the relationship between advocates and state agencies really help to make these policies pass and the momentum forward, and just even education. And I am definitely looking forward to, Julia, you speaking a little more in a bit on the hold harmless provision and the interaction between CEP and state compensatory education aids. Some states call it at-risk funding for education. But this is a challenge that we first saw come about when CEP was first introduced. And then for the most part, states figured it out and started to, work around ways to address the data source, missing that meal application data when a school adopts community eligibility and may no longer have that school meal application. But there are a few states out there. We're working closely with one right now where that seems to come up again in the legislature as they look at their at-risk funding. And there's, as you alluded to, Julia, these programs can be complicated and they can be confusing. And sometimes our policymakers don't always understand the interconnectedness of them all. So looking forward to what you have to say about that when we get to the question on what you're currently working on. And next, I'm going to pass it over to Signe Anderson in Tennessee. Signe, I don't know if you have all the snow the rest of us here on the East Coast has, but hopefully you have some great school meals and child nutrition legislation that you can share.
We just escaped a terrible ice storm, but
Oh.
all the snow has melted. So we're back to like 60-degree weather. Anyway, thank you, Erin and FRAC, for inviting us to be on today's webinar. And it's always a pleasure being on a panel with folks like Julie and Lisa. Tennessee Justice Center is very similar to what you heard about what Julie and Lisa do. We are a state-based advocacy organization, also doing work on the federal and local level, but focused on healthcare and nutrition safety network. I, of course, am focused on the nutrition safety network. We do direct client services and really use that interaction with clients to focus our advocacy efforts. And a lot of our work is focused on partnership building and communication and education around the nutrition safety net programs. And as far as some of the past wins and things that we've been working on, I think legislatively speaking, we had a win before the pandemic around legislation requiring all schools to operate school breakfast for K through 8 schools that are at 25% free and reduced price, and 40% for all other schools. So that was something, I think, beyond the legislation. Tennessee has had pretty good success with CEP participation, and just beyond state legislation as well. And coming from a conservative state, I will put a plug in there for administrative advocacy as well, in that we've had some success there with passing Medicaid direct cert. And those are some of the huge wins. The slides that I have in front of us, well, actually, before I go there, the third question that you asked, Erin, was about how we got here. A lot of it is the partnership piece. We have a huge focus on building partnerships. We're a small organization, and in order to do the work that we do, we really value and build those partnerships with folks across the state. So we've been working with school nutrition directors for a long time. We work with the Tennessee School Nutrition Association, community organizations. Our food banks are really strong partners in the advocacy work that happens across the state. Because we have a big arm of our organization working in healthcare, using that, the healthcare connections to bridge the work that we do on nutrition is also important. As well as other childcare advocacy groups. That has been really important. And then as far as getting here and moving into what we are doing, and Erin, I'll just pause once we get there, but getting to the current state, we've done a lot of work on the legislative side at the Capitol, fostering relationships with some of our more conservative legislators. For folks on the webinar who work in a more conservative state with conservative legislators, we have great champions on this in our Democrats, but sometimes it's hard to pass legislation that is sponsored by Democrats. So we've done a lot of work building relationships with not only our Democrats, but very focused on the Republicans, and educating our legislators, their staffers, and the public about the work that we do and about the importance of school meals or whatever the issue is that we're focused on. And so that all of that has kind of led to some of the work that we're doing now.
Signe, thank you so much. And Steve, I think we just have another slide or two if we could pull it up. Oh, I think we lost him for a second. Well, we'll just talk anyway, Signe.
That's totally fine. Yeah, I wanted to pause because my slides are very much focused on what's happening now and some of the successes we're hoping to see before the end of the session and into the next one.
Before we jump into what you're currently working on, though, I love that you brought up the healthcare community, right? And I love that you talk about that because we, like all of you, we talk about these policies and programs as investments because that's what they are. It's an investment, and I've done a lot of media over the last week, so I have the soundbite now stuck in my head. So apologies if you've heard me say it or you're going to hear me say it. But it's an investment, in the child today, but in the long-term future and the health outcome as a society. So I think healthcare really understands that, and they're able to speak that language somewhat that someone might hear it, that might not hear it from, say, an anti-hunger organization, right? And they can really talk about that. I also do want to do a very specific shout out to the Tennessee State Agency. I love all of the state agencies on this call and across the nation, but I am currently in the process of collecting community eligibility provision data for this year to do our annual report. And your state agency has been such a gem of going back and forth with me to answer all my questions. So shout out to your Tennessee State Agency because Latressa has been a doll. So thank you, Latressa. But Signe, let's transition and start talking about what you are working on this legislative session and maybe how that kind of helps mitigate some of the harms that we've been talking about with HR 1.
Yeah, so this legislative session, and again, this is part of like the building up to where we are now. In the past, we've had lots of great legislation addressing school lunch shaming and even efforts to pass free school meals within the state. Some of those bills were Democrat-led, which again is fine, and we've championed those. But we tend to have a kind of a partisan setup in our state in that some of the Democrat legislation does not get passed. And so we've done a lot of work to build those relationships. And last year, we ended up introducing free school meal legislation with two bill sponsors, Representative Lynn and Senator Harshbarger, to expand free school meals to the reduced price category, and have seen a lot of success with this bill. Our legislative session evolves over a 2-year period. And so last year it was introduced, it went through all the committees, passed through all the committees, and ended at the end of session just behind the budget. So that's where it is right now, and we are cautiously optimistic of seeing it pass before the end of this session. So that's one very exciting, positive piece of legislation. And I just want to emphasize, I mentioned that there is a lot of partisanship, but this is not it. The free school meals legislation has been one of those great sources of a bipartisan collaboration. And so we've seen both Republicans and Democrats sign on to this bill in support across the board. So that's been super exciting. And the other piece of bipartisan legislation that just got introduced this year is legislation around summer EBT. Tennessee is one of the few states that are not participating in summer EBT, did not participate last year. We did participate in the first year that it became a nationwide program out of the pandemic. But we did not participate last year. Our governor has indicated that we're not participating again this year. So a couple of the legislators that we've built a relationship with, we worked with them to introduce legislation around summer EBT. And so we're very excited about that. And the bill will make summer EBT a requirement. As long as it's offered on the federal level, Tennessee will be required to participate in summer EBT. And that too is going to be seen and heard in committee next week. So we are continuing to do a lot of work around that bill. And the next slide that I have up is a more visual slide. Part of our effort, and back to the partnership piece, has been really rallying other groups and organizations around the summer EBT. And one of those groups of folks that we've really tapped into and has seemed to catch fire are our mayors. We have 95 counties, which are a lot of counties to deal with, but over half of our mayors have signed on to a sign-on letter really urging our governor and the state to participate in summer EBT. And so this is just a visual of right now. I think we're at 58 states 58 county mayors that are really pushing for our state to participate in summer EBT. And so that's just a little taste of what we're working on. I think the last thing, Erin, you had mentioned broad-based categorical eligibility. That's another thing that we've been advocating for as well. We're hoping that our SNAP agency adopts this. We're one of the few states that aren't participating in broad-based categorical eligibility, but it would have a huge positive impact on school meals. It would have a huge impact, just to the HR1 point, on reducing the error rate. And so there is some work that we've done around advocacy there, and we're hopeful that we might see some progress on broad-based categorical eligibility. Even though you mentioned the threats on the national level, we're still hoping to see some positive movement on that as well before the end of our session.
Well, I'm so glad you mentioned that too, Signe, because we did just have a question come in through the Q&A function, and anyone in the audience, if you have questions, remember you can use that Q&A function. And the question from Katie really asks about, are there any states doing SNAP-specific enrollment? So SNAP-specific legislation to kind of protect the enrollment numbers within their state. So I am not the SNAP expert on FRAC, and I would definitely direct you to our director, Gina Platanino, who would have a much more in-depth understanding on a national level. And I know, Julia, you mentioned that you don't do SNAP, but Lisa, if you have anything as well, Signe just mentioned, they are applying for broad-based categorical eligibility. Katie, even as you mentioned in your comment, really looking to target those error rates and see how we can support reducing those error rate strategies. On a national level, FRAC is doing a lot of work to repeal those snap cuts. And I'll get to that as we talk about resources and drop a link to what we call our FRAC Action Network, where you can really start to advocate at the federal level to say, like, these cannot go into effect. We need to repeal these snap cuts. But if there's anything else, you just mentioned broad-based categorical eligibility. Julia or Lisa, if there's anything else that you are doing around SNAP too, feel free to include that. But I'm going to invite everyone to kind of come off camera, come off mute. Steve, we can pull the slides down. Thank you. And let's hear from Julia. We'll go kind of reverse order this time. What are you working on right now in Maryland this legislative session?
Yeah, so I actually can mention a SNAP bill that has come up this legislative session. It's not necessarily to mitigate any of the policies from HR1 that would help keep folks on the federal SNAP program, but we did have a legislator come in and introduce a bill that would create a state-funded SNAP program for refugees and asylees. So again, it wouldn't necessarily go to helping to mitigate that loss on the federal level, but it would help provide an additional benefit for families that have lost their eligibility because of HR1. In terms of child nutrition programs, we are still on our journey towards healthy school meals for all. Looking at our state budget, we've been in a little bit of a difficult position in Maryland over the past couple of years, so not a lot of additional funding available for new programs. And especially this year, knowing that there's a lot to mitigate with HR1. We've asked for a smaller amount of money than a full universal meal program. The current bill that we have in session right now is to provide an additional $10 million in annual appropriations to help CEP school implementation. Last year, this is a reintroduction, so we had this bill last year as well with the same two sponsors. So our wonderful bill sponsors, Delegate Polakovich Carr out of Montgomery County in the House, and Senator Gazzoni out of Howard County in the Senate, who's the chair of the Budget and Taxation Committee. They've been incredibly supportive in pushing this bill and continuing the conversation even in the midst of our budget challenges. Last year, we came up with this bill to try to support the expansion of CEP. So looking at funding the schools that might be eligible, but not necessarily in a place where they find it financially viable to implement CEP. This year, we have already seen huge drops in direct certification numbers looking at last year to this year, even before HR1 provisions were starting to be implemented. So I know we're going to see increasing drops in direct certification. So I think we're really hopeful that this bill will potentially pass to help maintain our CEP levels. We don't want to see schools drop off of CEP because they lose reimbursement levels and no longer find it financially viable. So we're hoping this will mitigate some of those losses. And then another piece of that hold harmless provision that I mentioned before, that kind of like first initial bill that we had in 2015 that helped us get to where we are with CEP to mitigate the losses of state compensatory education funding. That hold harmless provision is actually ending this year, or it's expiring. So this session, there is an extension in the legislature to hopefully extend that for 2 more years. But we also know that with the hold harmless provision in general, having it in place for 10 years isn't necessarily the most accurate data. It's not a sustainable solution forever. So there is the hope that there will be language also included in that bill to continue that conversation. Also recognizing that due to the cuts in HR1, our federal program counts are going to be less reliable moving forward. And so even if we base our numbers on direct certification, it's not necessarily going to capture as many students or the accurate number of students in the next couple of years as we see those cuts taking effect. So that part of the conversation, we're really hoping to put some guiding language in that bill to find different ways to stabilize those counts, to maintain that critical funding for wraparound services, for education funding, to make sure that our students aren't losing access to the resources that they and their families rely on when they go to school and have access to those resources that are currently in place. So I know that's an issue that a lot of states are having. We're hopeful that we can create a more sustainable solution that is, stabilizing and long-term, that can include some of our state programs, and our state data as well as federal data. So we'll definitely keep folks updated as those conversations move forward.
Thanks, Julia. And their CEP bill like mirrors your Maryland Meals for Achievement breakfast bill in that was like year after year, you went back for some more funding and some more funding and some more funding until eventually the legislature passed full funding for breakfast in schools above 40%. So chipping away at it little by little.
Yep.
Lisa, what are you guys focused on in New Jersey right now?
So with regard to SNAP, we're coalescing a group of advocates now to really come up with some potential legislative strategies to try to mitigate some of the harm of HR 1. So those conversations have started. We're very lucky in New Jersey because we have a very robust SNAP Navigator program that was actually created through legislation as well. And we have about, I'd say probably a little over a dozen organizations that have SNAP Navigator teams. So we have all 21 of our counties are covered. So we convene the SNAP Navigators through the New Jersey SNAP Alliance. And we have been providing some training and technical support along with our partners at Legal Services of New Jersey on some of the changes and cuts to SNAP under HR 1 and really trying to arm the SNAP Navigators with the knowledge that they need so that they can be out in the community educating families that are receiving SNAP about the changes, what they need to do to make sure they keep their benefits, and even screening people for exemptions from the work requirements and things like that. So it's not, the remedies so far have not been legislative. They've been more sort of, grassroots and organizing and training and technical assistance. What we are doing, a lot of our messaging is really to our legislators is the time is really to lean in. The time is now to lean into the child nutrition programs. We really need to be focused not only on expanding access to free school meals, but what can we do to, remove some of the barriers to CACFP expansion. We've been doing a lot of work around after school, and specifically around at-risk after-school suppers, and recruiting some new sponsors and sites around the state. Also working on summer meals, doing a lot of outreach and education on summer EBT, which New Jersey's done a really good job of rolling out, working closely with our state agencies. And then the big thing that we're focused on this year is, we have a School Meals for All steering committee. We've had a campaign since 2022. Given some of the budget constraints that Julia and my colleagues have mentioned, I mean, New Jersey is not exempt from those, and certainly the SNAP cost sharing under HR 1 is going to have a profound impact on New Jersey. So we're trying to be sensitive to that. So our ultimate goal is to get School Meals for All legislation passed in New Jersey, but we've decided, given everything that's going on, that we're really going to dig in and try to get some school breakfast for all legislation introduced this year. So we don't have a bill introduced yet, but we've been having some really good productive discussions. There's some interest there. So we're really excited, and we're really hoping that we can get universal free school breakfast implemented for next school year and during next school year.
And it would complement the legislation that you've already talked about and worked on to do breakfast after the bell, right? So it just goes hand in hand. Sydney, there is a question on the chat. If you could touch on, Texas, and we talk about this a lot, Sue, because when your governor vetoed summer EBT, part of the reason he said he was vetoing it was because of the SNAP cost shifts and the administrative cost shifts of that. And so at FRAC, we really jumped on that and said, this is how HR1 is hindering other child nutrition programs. But Sue is asking, Signe, being in a more conservative state that did not initially adopt summer EBT, how are you kind of getting over the hump? What is working?
Yeah, I mean, I think the overwhelming support from partners and groups like mayors across the state have really pushed the narrative that summer EBT is really important, and this is a cost that is worth dedicating to children in our state, and I think we're winning the narrative because we do have all these legislators that are out there pushing legislation to get the state to actually operate it moving forward. And I'm glad she brought up the cost shift piece. There's a lot of misinformation around how the cost shift is going to impact our state. And so we're putting a lot of effort into making sure that our elected officials and other folks are educated in what the cost shift actually means. And the other piece to this in HR1 and the SNAP work, we're really concerned about the work requirement piece and how that now affects families. In the past, it was adults without children. And now there's a lot of information that we're trying to share because even families who have children that are still in the exempt category are getting information. And so we're trying to make sure that they're not confused and losing access to the program because of that. So a lot of it is information sharing and explaining the reality of what it means and really educating on the importance of investing in our families who need these programs. We're also doing it used to be a weekly briefing, but now it's a monthly briefing with partners across the state on action items and talking points and things that folks can share with their elected officials. Because we do a lot of communicating with our elected officials, but it's really important that other individuals and organizations that are also in the space are saying the same things that we're saying and presenting the problems with HR1 and what's happening from their vantage point, so that we're not the only ones talking to legislators. They're also hearing from their constituents and other organizations that are important across the state. So I hope that helps. A lot of it is just messaging and persistence and education.
Persistence is key, right? Sue, thank you for the question. And I know we're running out of time quickly, so we're going to transition to resources. But if anyone has additional questions or you think of new questions after the webinar, please don't hesitate to reach out. I'll drop my email in the chat. I am sure our lovely panelists would be more than welcome to connect with you. I just volunteered you guys. I'm sorry. I probably should have asked you first. But you can email me and then they'll give me their blessings and we'll get all your follow-up questions. So I think to Signe's point, the more unified our voices, the more uniformed our talking points are, I think the stronger we sound. So let's touch high level on some resources. All of these links will be included in the follow-up email that you'll get in a week or so. Next slide, please, Steve. We have a policy brief that we released in January that looks specifically on HR1's impact on child nutrition programs. So school breakfast, lunch, summer and after school meals, summer EBT, and WIC. It's about a 7-page document, but it goes into all of the cuts to SNAP and the impact we believe that they will have on the other programs, and then recommendations on what we can be doing to try to mitigate the harm. Next slide. There's also a webinar that we hosted that talks about the same thing, protecting progress in child nutrition programs. It is available on our YouTube channel. So if you're not familiar, all of our webinars are posted on our FRAC YouTube channel, and you can go back and listen to my Jersey accent at any time that you would like to. Next slide, please. We also have a Healthy School Meals for All state advocacy guide. This is on our Healthy School Meals for All website. It really kind of guides you through the whole process of advocating for state policy for healthy school meals for all. So everything from coalition, who would be part of that coalition, communications. It talks about some case studies of states that have already passed the policy. So take a look at it, see if it's helpful for you as you work towards healthy school meals for all in your state. Next slide, please. We have community eligibility provision fact sheets by state. So we took last year's data. We did this in partnership with the Center on Budget and Policy Priorities. And we looked at CEP adoption, the number of schools that were participating, the number of schools that were eligible, how many children being reached. And then on the back side of the document, we matched when we were able to against your congressional district, so your federal representatives, to show which CEP schools are within their district to help you advocate on a federal level on why these programs are so important. Next slide, please. We mentioned this earlier. I will drop a link in the chat now. We are working diligently, tirelessly, and every day and night and weekend here at FRAC to really fight against these snap cuts in HR 1. We know how devastating they are going to be. And so we want everyone to understand the impact and reach out to their federal representatives. So this is an easy way that you can contact your members of Congress and demand that they repeal the cuts in HR 1. Next slide, please. And then join us. We are quickly approaching our annual anti-hunger conference. It is April 26th through 28th in Washington, D.C. It is a group of national advocates coming together to share ideas, to learn from each other, and to get up on the Hill and tell our federal representatives that we need to make investments in our federal nutrition programs so that every individual across the country has access to the nutrition resources that they need to thrive. And with that, we are going to end today's webinar. Thank you so much to Signe, Julia, and Lisa for sharing their insight and their expertise. If you have any additional questions, please don't hesitate to reach out. I'm Erin Heisam. It's eheisam@frac.org. I'm more than happy to connect you with any of our panelists today or anyone else from our team who can help you answer your question in our fight against hunger. Thank you, everyone, and have a great day.